Hi, welcome. This is our presentation from Liverpool John Moores University for our student nursing courses, undergraduate nursing pre-registration, and we're going to tell you a little bit about our courses. I've got with me today Kevin and Rosita, and they're going to do the presentation. So my name's Keely Guest, and I'm the head of undergraduate nursing at Liverpool John Moores University, and we have the senior lecturers, Kevin and Rosita, and they're going to talk you through a nice presentation. Okay, thank you. Are you okay to share your screen?
Yeah, just share. Okay, thanks.
Can you see your screen?
I don't think that's shared. Can you see that? No, let's try again. Is that? Can you see the presentation? Yeah.
Yes, we can see your presentation.
Thank you. Hello, so thank you. So I'm Kevin, as Keely said, I'm one of the senior lecturers here at Liverpool John Moores University. I'm just going to present a short presentation to introduce you to the university itself and also to the programme. So do think of any questions that you have along the way, because there'll be an opportunity at the end to speak to ourselves and other members of the team regarding the programme and the university itself. So we're going to have a chat about the pre-registration nursing programme. So first of all, I think it's important that we welcome you to LJMU just by giving you a little bit of background about the university itself. So we are a prestigious and award-winning university based in the northwest of England. We've got a long history of nurse education. And at the moment, we attract lots of students, hundreds of students from around the UK and also from Ireland. So we're already a very popular choice for students who wish to study nursing. We've now opened our doors to international students, which is a really exciting opportunity for us to bring people from further afield to study nursing with us here at John Moores. And we really look forward to welcoming lots of students from around the world to join our student body here. Interestingly, lots of the staff who work here, most of us are registered nurses or registered healthcare professionals, and lots of us have been students ourselves here at one point or another, myself included. So I studied here 25 years ago and I've come back full circle to work in education. So I think that's always a good sign of a good university when people who've been here come back as employees in the future. So we really look forward to welcoming you here as international students to be part of our history, part of the journey of nursing education here at Liverpool John Moores University. So a little bit about the city. So yes, we're a prestigious and award-winning university, but we're also lucky enough to be based in a world-famous city. So a world player when it comes to cities. Liverpool. I'm sure you've heard of Liverpool already, or you'll have some familiarity. Maybe it's through our famous football teams or our famous music scene. It's not just the Beatles. There's lots more to Liverpool when it comes to music. We're actually, we have been rated by Time Out magazine as the 7th best city in the world to live. So think of all the hundreds of cities, thousands of cities in the world, and Liverpool is the 7th best according to Time Out magazine to live. And amongst the student body, we do have lots of students in Liverpool. It's a very student-orientated city, and we've actually been lucky enough to be voted as the #1 student city in the whole of the UK, and that's by the Student Crowd. So the Student Crowd, if you're not aware of that, is an independent review, online review body, which is run by students themselves. So #1. For student experience, which is absolutely fantastic. I'm going to play you a short video. It's only on for a minute, and it's an introduction to the city. So you will see some of the sites and also the range of activities that we have available in the city for students and for anybody that lives here. It really is a wonderful city. So I hope you find this little introduction here interesting.
John Moores University. Now it's Liverpool John Moores University. Not just a place, not just a city, a community, an identity, a hub of exploration and creativity, staging global events, music extravaganzas, parades and celebrations, to hosting independent gigs, businesses and a nightlife for all generations. We've got it all. Culture bursting from each pocket of the city. The docks, Baltic Triangle, our city centre, teeming with galleries, museums, entertainment from every angle. We never get bored. A feeling of being part of something each and every day. The style, the humour, endless realms of opportunity. It's the city that welcomes everyone, embodies individuality and embraces everything. So what are you waiting for? Come and be a part of it.
Okay, so I hope you enjoyed that brief introduction. Obviously, there's lots more, but there really is something for everybody within the city. And, hopefully one day, you people out there will be walking amongst these streets and taking part in some of those activities. So for the next few minutes, we just want to focus on the course itself and maybe some of the reasons why you want to come to Liverpool. So it's not just about coming to this fantastic university and our fantastic city. It's got to be for the right reasons, hasn't it? It's got to be for the right programme. So you've joined us today because you're interested primarily in nursing as a profession. So we'll have a little think about what is nursing and what is attracting you to this profession. Why do you want to be a nurse? So have a little think about what your understanding is of nursing itself. What is nursing? Well, nursing is to work holistically, as it says here, isn't it, in complex or specialised areas. So nurses work autonomously, but they also work in unison with wider teams, doctors, nurses, physios, and those sorts of professions to help improve patient outcomes. So what that's saying is, as a nurse, it's not just task driven. A long time ago, nursing used to be what we call task driven. So, you would see a patient who needed fixing, they needed a blood pressure doing, or they needed a wound dressing, and nurses would be very focused on just providing that task alone. But we've moved away from that now. What we would call holistic practitioners. So what this means is we look at the patient as a whole. So we're not just performing a task, we're looking at the patient as a whole human being with lots of different needs to be met, and we're there to meet them. We need to be able to work independently, so we need to be able to work autonomously, but we also need to be able to work as part of a team. And that can be quite a skill. So have a little think of yourselves in your own lives. Have you got the skill to work as independently on your own, but also to contribute to a wider team as well? Because that's a really key skill when it comes to being a good nurse and providing this quality patient care that we want. To be a nurse, it's also important to demonstrate the right skills and professional values, as well as having knowledge and education to study at degree or MSc level. So what we're saying here is, nursing, it's much more than just providing skills. That there is an academic element to it as well, and there's an academic of acting within professional values. So there's lots. You're called on quite a bit as a nurse to do much more than just provide tasks and patient care. We've got to be professional at all times, professional in our work life, and even in our home lives, in our private lives as well. We have to abide by a code of conduct. And we also need to be educated to a certain level as well, which is what we will provide for you. We'll do both. We'll provide you with the skills, but we'll also provide you with the knowledge that underpins those skills as well. So why nursing? What is attracting you to nursing? So have a little think about that. Why do you want to be a nurse? What is it that's drawing you to this wonderful profession? So some of our students here, these are some of the things that would have attracted students to our university in the first place. So nursing is exciting and unpredictable. So every day in nursing is different. You could be in a role where you are nursing different people every day, facing different challenges every day. So it is certainly unpredictable. It's not the mundane 9 to 5, same sort of thing every single day. So it can be challenging, but it's also very, very exciting as well. It certainly does come with a lot of responsibility, but with a lot of responsibility also comes reward and personal fulfillment. And I can say this from experience as a registered nurse. It's one of the most wonderful jobs. There's nothing better than coming away from your job at the end of a busy day and thinking, I have made a difference. I have done something good. I have helped somebody, and all this goes towards personal fulfillment, and you will certainly find that within the nursing career. There's very diverse opportunities available once you qualify, and we'll have a little look at them in a second. So nursing, it's much more than that traditional sort of image of the nurse as somebody who is just washing patients or fluffing patients or making sure a patient is comfortable or just following the orders of a doctor. There's much more to nursing now than that. As a profession, we've really moved on over the last few decades to be a really recognised autonomous profession that you can be part of, that this is something that you can definitely do. We certainly make a difference. I can't think of any other jobs where we make such a difference to people. I mean, this is either making people well again, making people better, returning them back to their normal state as best we can, or helping people who we can't fix. So there will be people who we can't make better, but it's how we prepare them to live life, an adapted life, how we promote a quality of life for patients who maybe will be leaving hospital in a different state to what they were used to. And this is an interesting point. People will remember you. So there's nothing better when you're a nurse as a patient remembering you. So you might look after a patient one day, and then they return to the hospital weeks and months later, and they remember you. Oh, there's that lovely nurse. That was that nice nurse. You were the nurse that helped me. And you might not always remember them, but there's something really special about a patient remembering you for positive reasons. And also as a profession, it's not just hospital-based. You can work in a whole range of environments, and there's lots of opportunity for career progression and travel as well. So as students come into the UK, this will be a travel opportunity for you. But once you've trained here and you fulfill the programme and you're registered with the Nursing and Midwifery Council here in the UK, you could then travel, and it opens up a whole world of opportunity to you. So as I said before, nursing is much more than just that traditional stereotype of nurses working on a ward, following the doctor's orders and making patients feel comfortable. There's a whole host of roles. There's a few listed here, but there's hundreds of roles. We could do a whole presentation alone on the amount of roles there are for nurses. So here's just an example of some of the roles that you could fulfill as a registered nurse. So you could work in community. So that's going, visiting patients in their own home, in residential homes, in nursing homes, etc. You might want to work in an intensive care unit. So, one-to-one, a very, very high pressured area where you'll have the skills to deliver good quality care under pressure and with very, very ill patients. You might want to go into research. So everything we do as nurses is what we call evidence-based. So we don't just do it because that's what nurses have always done, or that's what we've done for 100 years, or that's what the nursing sister taught me as a junior nurse. Everything we do has to be evidence-based and has come from robust research. So lots of nurses go into research themselves and are a really vital part of research teams. So perhaps that's something you could think about in terms of career progression. You might want to go into public health, or you could go, be a surgical nurse. You could be a palliative nurse, a safeguarding nurse. So, a really valuable resource in a hospital is the nurse who's the safeguarding lead. So, any concerns about elder abuse or financial abuse, child abuse, any of these sorts of things, the safeguarding nurse is a vital link to services and to safeguard patients. You might also, lots of nurses go on into executive roles. So again, it's not just that traditional nurse role of looking after patients in wards and surgeries and GP practices. You might go into the business side of nursing, where you could become a matron or an operational manager or a chief nurse. There's nothing to stop international nurses with NMC registration from going to the heady heights of chief nurse. Who knows? You might even come into education. So as I said, most of us at the faculty have been nurses or are nurses. We are registered nurses, but we've come into education. So there's also avenues into education as well. So a whole load of roles. So don't just think of nursing as that old-fashioned traditional hospital nursing. It's a really vast, expansive role. So how can we prepare you for this, for being a registered nurse? So what skills will you learn? So we teach lots of skills at John Moore. So before you go out into any practice placement, so that's when you go to the hospital or the GP surgery to do further training under the university's guidance, we will train you and educate you and teach you some of these skills that then you can develop further out on practice placements. So things like fundamentals of nursing care. So we used to talk about basics of nursing, but we don't do that anymore because there's nothing basic when it comes to nursing. So we talk of fundamentals of nursing care. So that's how you provide that one-to-one valuable patient care. We will teach you things that keep you safe and patients safe. So things like manual handling. So, you know, that could be how you turn a patient in a bed, how you assist a patient from a chair. So I should imagine, unless you've worked in healthcare or maybe you've looked after an elderly relative or a sick relative, you might have no experience at something as simple as helping a patient out of a chair. So we will make sure that you have those skills even before you go out on live practice placements. Then we'll teach you some of the more complex nursing skills like venipuncture, so taking blood from a patient, nasogastric insertion, so popping a tube in a patient's nose, for example. We'll teach you how to do manual blood pressures, injection techniques, cannulation, so, you know, popping a line into a patient's vein so we can give them IV medication. And we'll also teach you BLS, basic life support. So before you go out on placement, you will be competent at delivering basic life support. So some of the skills you might learn as a nurse. So communication skills. So again, it's not just the physical skills. We need to know how to communicate with patients, how to communicate with relatives and the whole big team that we could be working with as a nurse. So we will teach you some skills around communication. We will also teach you medication management. So one of the big responsibilities of being a registered nurse is administering medication and administering medication safely. So this is something that we will teach you throughout your 3 years with us. We will work with you to ensure that when you qualify in 3 years' time, you are competent and able to give out medication safely and understand all the safety aspects of giving out medication. We also focus on leadership. So again, you know, it's not just those roles working with patients. You might want to progress. So we will give you the foundations to leadership and show you how to be a good leader. We'll also teach you some of these things. So don't worry, because you might not understand what these are at this stage, but I can guarantee, should you come and join us within your first year of student nursing with us, you will really understand some of these concepts, such as A to E assessment and News 2. So some really vital nursing skills that will help you be able to spot a patient who's deteriorating and also be able to monitor and act to assist that patient who is deteriorating. We'll also teach you SBAR, so that fits in with communication skills, so that will enable you to be able to hand over patients to other professionals, to other doctors, to other nurses. So all these wonderful skills we will equip you with and furnish you with, which will enable you to both go out as a confident student nurse, but also will stand you in good stead and prepare you to be a registered nurse as well in 3 years' time. So what does the programme itself look like? How are we going to fit all these wonderful things in? So it's a 3-year programme, and it's divided into 2 halves. So it's 50% practice and 50% theory. So what that means is 50% of the programme is you out in practice placements. So we have really good partnerships with local hospital trusts. We have lots of big hospitals in this part of England, in the northwest of England. And we have partnerships with those hospitals, along with GP surgeries, along with school nurses, nursing homes, lots of healthcare settings where we can send students to. So 50% of your time with us will be spent out in real life practice with real life patients. The other 50% is theory. So that is as you come into university for lectures, you might have directed study to do at home. You will follow the timetable, and that will tell you exactly what you should be doing at that time. There's also a range of assessments. So as well as a range of practice placements, we have a range of assessments because we recognise that not everybody is very good at writing academic assignments. So traditionally, when you came to university, your assessments would consist of essays. But here at John Moores, we have a range of assessments to suit everybody's needs. So yes, there are some academic assignments. There will be some academic written assignments, but we also do the traditional exams. We could do multiple choice exams. We do presentations. We do professional conversations. There's a whole range of assessments, and this will make much more sense when you see it in practice when you come and join us, hopefully in the near future. So just a quick chat about our simulation suite. So this is something that we're very proud of here at John Moores. So we have 3 floors in the School of Nursing of simulation suites. So what the simulation suites are a mock hospital, if you like. So it's a mock-up or an artificial representation of a real hospital. But we have 3 floors with hospital wards. We have hospital beds, we have a nurse's station, and it's really set up to look like a real hospital. In the beds, we have mannequins, and these mannequins are almost lifelike. They can blink, they cough, you can do blood pressures on them, you can interact with them. It really is state of the art. And before you go out on a real life placement, so before we send you to a hospital placement or a GP practice or wherever that might be, you will have a placement within the simulation suite. So what that allows you to safely do is practice some of those skills, learn some of those skills, taking blood pressures, taking pulses and that sort of thing. But it's in a very safe and controlled environment. So by the time you do go out to a live placement and meet real life patients, you've already got some knowledge and some practice, and that will really help you with your confidence when you go out on placement. Okay, so just before I hand you over to Rosita, I just want to tell you about some of the support that's available here. And this is for all students, not just our international students, but all students who come to LJMU. We're passionate about supporting students throughout their journey with us. We understand that being a student nurse can be challenging at times, and we want to support students from the moment they join us to the moment they graduate in 3 years' time. So these are just some of the examples of some of the support mechanisms that are in place. So when you come to us at John Moores, you will have a personal tutor. So that is one of the nurse lecturers who is your designated go-to person. So any issues at all, you would speak to your personal tutor, because there's lots of tutors here and sometimes it's difficult to know who do I go to with an issue. So you will have a named personal tutor, and they'll be your named personal tutor for the 3 years that you're with us. They can meet you informally, so any time you need to meet them, you can drop them an email or arrange a meeting with them. But there's also formal points throughout the program. We call them PDPs, or personal development plans. So there'll be a number of formal meetings with your personal tutor throughout the 3 years, and they can help to see where you're up to, keep you on track. How many hours have you done? Where you're up to at your assignments? How you're getting on generally. So we do look after you for the whole 3 years. When you're out in placement, we can go through this in more detail when you do join us, but there are also a group of designated nurses within our National Health Service placements who are there to look after student nurses in particular. And then you've got the likes of your cohort leads. So if you join a cohort, which is the big group of students you would join in the September that you join us, there's a lead who looks after that particular cohort. So again, you will know who that named person is. If you're worried if you ever have any additional abilities, it could be a range of additional needs, then we take that into consideration as well. So should you need additional time for an exam or any sort of special provisions, we have a team here who can meet with you and see how we can meet those needs to ensure that we can support you again through the programme. We also have our student mentors who are an absolute fantastic resource. So these are students who are at the university, but they just step up into the role of mentor. So anything you wanted to know from a student point of view and you wanted to know it from another student, then we have student mentors on hand as well. Then we also have across the whole of John Moores, the student advice and wellbeing team. So it can be challenging, as I said, to be a student nurse, and sometimes you might need additional support. And we have the student advice and wellbeing team who are available for drop-in, for appointment, for one-to-one support if you need that. And then we also have the wider student union as well, which is across the whole of John Moores, should you need input from there. So lots and lots of groups and teams and individuals who are here to support you as a John Moores student, to ensure we get you through the 3 years smoothly and onto the NMC register at the end as a registered nurse, which is our ultimate goal. So thank you for listening to me. I'm just going to hand you over to Rosita now, who's going to talk about some of the entry requirements and some further information about the course. So thank you very much.
Hello everyone, my name is Rosita. I'm one of the senior lecturers at Liverpool John Moores University alongside Kevin. So the entry requirements and alternative courses. We have our undergraduate program, which is the BSc nursing program, which is a 3-year program, as Kevin explained to you. We have practical as well as thought program in the uni. So this is a 3-year program which enables you registration as a Band 5 nurse upon completion of the 3 years. So the entry requirements are Indian equivalent will be the CBSE and ICSE, and 80% or above is required, the mark wise, if you look at. And we also have a test called Cleverly, which is mandatory, and it is an aptitude test, which you have to do it on the computer. And all our course, the undergraduate as well as the postgraduate courses, is approved by the lead of the nursing, which is the Nursing and Midwifery Council in the UK. Then we have the postgraduate nursing program, which is a 2-year program, which also enables registration upon completion as a Band 5 registered nurse, and it gives you a degree at 2.2 or above in any subject. For this, we require an evidence of 700 hours experience. Either it can be, looking voluntary after the elderly, or any paid work, voluntary or paid work in clinical experience. So it all depends upon successful interview as well as following the application process. All our postgraduate students will have to have a valid portfolio at the interview. So the course, as you can see here, it's the application opens on, it's actually open on the 1st of September 2024 for both the undergraduate and postgraduate courses. Application deadline is the 31st of May 2025. Early payment deadline is the 30th of June 2025, and deposit deadline is the 20th July 2025. CAS is actually the confirmation of acceptance for studies. It is issued and the deadline is the 15th of August 2025. And normally our course starts in September. Okay, and then care experience, as I mentioned earlier, evidence of caring for people is required, and that's either it can be done voluntary or paid work. So evidence of caring for people within the last 3 years, or transferable skills gained from contact with the general public. Usually we say adult nursing because we are recruiting only for adult nursing. So as university selection process, LGMU selection process, we use a wide range of assessment across the nursing program, and these can include MS Team interview, which is done on Microsoft Teams, and we ask about 4 to 5 questions, and we have a team that interviews. It can be done on Teams, and then there is a platform, as I said to you before, which is called Cleverly, which have a nursing aptitude assessment, which you have to do, and it's mandatory. Further guidance can be found by asking academic staff today. We will have a Q&A session later, so you can, or by accessing the courses on the web pages. So opportunities at LGMU, we have lots of opportunities for you waiting here, which is we offer international students placement to other countries, that is international placements abroad. So it lasts for 4 weeks to East Africa. That's where our students have been, and some of the students have have got the opportunity for this, which was paid by our university as well. So if you are eligible, and if you have an interest to do that, we give you an opportunity to go, and sometimes you will be lucky that you will be paid for it as well. So employability after or while you're in the course, we have a department which is called Unitems at Liverpool John Moores, which is our own on-campus recruitment agency, which provides opportunity for our students to access paid work in support for their studies that will strengthen their CV, their employability skills, and their organizational awareness. So we have open days, and our student mentors support us along with the academic staff. They come in and they help us to support the students who are coming to view our campuses. So they are like student mentors with boards. They stand and welcome the students, offer them support, and give them their experience, share their experience to them, etc., etc. So and it is well paid as well. And students who have been on Unitems have got great comments about Unitems and how they have developed personally as well. So 98% of our graduates are in employment, and you become a registered nurse either in the UK or you can go abroad. Sky's the limit. So international student feedback, we did a pilot project last year, and we had 9 students whom we recruited from Kerala, India. So they came in August last year, and they are here with us. And some of their experience, what they had to say was, studying in Liverpool felt exciting and fulfilling with its lively atmosphere and friendly people. And studying at LGMU particularly made learning feel fun and meaningful. This is what they had to say, and they are really coping well. They are also working part-time because they are allowed to work 20 hours part-time as well. So thank you for listening.
Thank you so much, everyone, for giving us this insightful presentation. Now time for Q&A session. I will help you call out the question from the YouTube chat box. So the first question is, are there any scholarships or financial options available for nursing students?
There's not funded scholarships from the university, no. You would have to pay the tuition fees.
Okay,
Unless there's
so next,
opportunity in India to get scholarship from the local government, but there's not UK scholarships, no.
okay. So next question is, how does LGMU support international students in terms of accommodation and settling into university life?
I'm happy to answer. Hi, everyone. I'm Ludo, regional manager for South Asia. So in terms of accommodations, we do offer accommodations here at university. Of course, we do have accommodations that for year 1 students, master students as well. They will need to have an offer and apply to our courses. And then the entry point is £90 per week. You can find on the website, minimum is 90. In terms of financial support, let me just follow up. So we do have the so-called discount. For UG students, it's a £3,000 discount on your tuition fees for every year of study. So year 1, year 2, year 3. You will see your fees will be reducted by £3,000. If you pay your deposit by a specific deadline that was mentioned in the presentation, you will get extra £500 discount on your tuition fees. So please be aware of the deadline.
Okay, thank you for answering this question so well. So next question is, what are the career prospects and support services available for nursing graduates?
I can answer that one. The career prospects are that you would be a registered nurse with the Nursing and Midwifery Council in the UK. So you could work as a nurse in a range of settings in the UK, but that's also a transferable qualification. So places like Australia, I think lots of Europe, UAE, they all take the UK nursing qualification and the registration as well. So you could be a nurse in any one of those countries, and obviously back in India as well. I think in the presentation, I think Rosita and Kevin talked about some of the different roles that the nurse can also do. So it's not just in a hospital. There's care homes, there's community nurses, there's lots of variety of different types of nurse that this qualification would enable you to go into.
So next question is, what nursing program does LGMU offer and what are their unique features?
So I suppose one of the brilliant things that we do is the use of the simulation suite. So rather than just, I think we did mention it before, so rather than just send students out to live placements where they'll be exposed to working with real patients and other nursing staff, before that happens, we do a simulated placement. So your very first placement on the programme is actually here in the School of Nursing in our simulation suite. And that's a 4-week placement. So sometimes it might be split into two-week placements, but it gives students that opportunity to practice something, to learn the skills to begin with, to practice the skills with the mannequins and with staff members, you know, interacting with staff members. And the feedback from our students is that they find it really, really beneficial. So it helps you build up your confidence and your competence in those skills before you go near a real life patient. Students do find it really, really beneficial. And we also get really good feedback from our practice partners as well. So the placements where we send the patients to, you know, the hospital trusts or the GP surgery, the feedback from the staff there is that they find our students are much more settled, much more confident, and much more ready to deal with real life patients because they've had that simulated placement. And other universities do similar. They do have simulation suites, but ours is huge. We really do take simulation seriously, and we really do use it well. So we have 3 floors, a huge simulation suite where students are exposed to a number of scenarios and skills, which will definitely give them more confidence for placement.
Okay, so next question is, what are the entry requirements and application process for international students?
Yes, I can answer that. The entry requirement is we require 80% above for the 11 plus, 10 plus 2, that is plus 2 marks. That is the Indian equivalent of CBSE or ICSE or the state syllabus. So we require that, and above 80% for English and maths, definitely. So that's a requirement, as well as having some care experience. Like I said in my presentation, we did describe about having care experience, working voluntary or in aid work.
If I may add to this, in terms of the requirements, you can apply to our bachelor courses. You can apply through UCAS or directly to us, whatever works for students. If you apply for masters, you can also apply directly to us. So you've got multiple points if you wish to apply for our courses. Can be the bachelor or a master.
So there is one question like, what about the IELTS? IELTS. I guess he wants to know about the procedure or something.
So we do accept IELTS and equivalent tests. Can be TOEFL, can be as long as in terms of IELTS, the IELTS we required is a 7.0 overall. You'll find all the information on the website. We do accept alternative tests to IELTS, or whether they will need to match the 7.0 of what has been published on the entry requirements page for both the master as well as for the bachelor.
So is LGMU providing any placement after the course, or do you have any placement partner hospitals?
Is that in terms of employment or for placements themselves? So we do have really robust partnerships with the local hospital trusts, with the local Merseycare, the local mental health trusts, the nursing homes, the residential homes. We do placements as well, which are non-clinical, for communication experience, etc. And we do have really close relationships with them. When it comes in, so that's where we send students for placement. When it comes to employability, we do provide, jobs fairs towards the end of the programme. And what we find is students, through being on placement, have already started to build up relationships with various wards and some of the practice partners themselves, which eases them into employment. So we do provide job fairs where we'll invite the practice partners in towards the end of the programme, which increases employability as well.
Okay, so I've covered all the questions from the YouTube chat box. Thank you for answering all the questions so well. Would you like to share any final words?
We would like to say, we really look forward to welcoming international students. The students that we have now, our small pilot study that Rosita mentioned, are really, very positive about their experience so far, not just with the programme, with the university, but also with the city, and the sort of the wider programme.
From my side, if I may, to all the students that are currently looking at, please be aware of the deadlines when you apply. If you're thinking to come, and we really want to see you here with us in September, please make sure that you start your application as soon as possible. We've got deadlines that are a bit earlier than the rest of the courses because due to the nature of the course itself. So make sure that you apply as soon as possible. Make sure that also you pay the deposit before the deadline to get extra £500 discount. In addition to the discount you will get every year of study, which let me repeat, is £3,000 for every year of study for your BSc nursing, and then we got £4,000 for the MSc nursing. So, but please stick to the deadlines. It's really, really important.
Thank you so much, everyone, for your valuable time. All the audience, if you have any further questions, please feel free to contact the SIUK India office. For more update, do follow us on our social media handles. Bye-bye. Take care. Thank you so much, everyone, for giving us this wonderful presentation.
Thank you very much.
Thank you.
Bye.
Bye-bye. Goodbye. Thank you.